Coronavirus myths and misinformation debunked by WHO, World Health Organization. As the novel coronavirus, and panic about the coronavirus, continues to spread around the world, so too are bogus claims, conspiracy theories, and misinformation about the disease. There's so much inaccurate information floating around out there that the World Health Organization is calling it an infodemic. In perhaps the clearest sign of the times, WHO has debunked some key myths to help set the record straight. The myths exist both on the fringes of the internet and in more mainstream outlets. And while social media platforms are now taking steps to elevate credible information and remove content that could confuse people, they're fighting an uphill battle. So now let's dive into the video and debunk top 7 key myths. Myth 1. New coronavirus affect older people, or are younger people also susceptible? People of all ages can be infected by the new coronavirus, 2019 nCoV. Older people and people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus, for example, by following good hand hygiene and good respiratory hygiene. Myth 2. Thermal scanners are effective in detecting people infected with the new coronavirus? Thermal scanners are effective in detecting people who have developed a fever, i.e., have a higher than normal body temperature, because of infection with the new coronavirus. However, they cannot detect people who are infected but are not yet sick with fever. This is because it takes between 2 and 10 days before people who are infected become sick and develop a fever. Myth 3. The new coronavirus cannot be transmitted through goods manufactured in China or any other country reporting COVID-19 cases. Even though the new coronavirus can stay on surfaces for a few hours or up to several days, depending on the type of surface, it is very unlikely that the virus will persist on a surface after being moved, traveled, and exposed to different conditions and temperatures. If you think a surface may be contaminated, use a disinfectant to clean it. After touching it, clean your hands with an alcohol-based hand rub or wash them with soap and water. Myth 4. Eating garlic helps prevent infection with the new coronavirus. Garlic is a healthy food that may have some antimicrobial properties. However, there's no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. Myth 5. Hand dryers effective in killing the new coronavirus? Hand dryers are not effective in killing the 2019 nCoV. To protect yourself against the new coronavirus, you should frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are cleaned, you should dry them thoroughly by using paper towels or a warm air dryer. Myth 6. Pets at home spread the new coronavirus, 2019 nCoV. At present, there is no evidence that companion animals or pets such as dogs or cats can be infected with the new coronavirus. However, it's always a good idea to wash your hands with soap and water after contact with pets. This protects you against various common bacteria such as E. coli and Salmonella that can pass between pets and humans. Myth 7. Antibiotics effective in preventing and treating the new coronavirus? No, antibiotics do not work against viruses, only bacteria. The new coronavirus, 2019 nCoV, is a virus and, therefore, antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the 2019 nCoV, you may receive antibiotics because bacterial co-infection is possible.